What's up everybody, Andy here from Movement Reborn. I'm super excited to start this new playlist, vlogging with my fellow pros. Now for a practitioner as myself, I move around, I do all of those things, and I help a lot of people, but I need self-care too. So I decided to open up the series to be able to show you the amount of treatments that I go to and also get treatments from other practitioners that I've never met as well. So many of these professions are just so overlooked and we don't know what's out there outside of our traditional care. Most of the times we have injuries, pain, health conditions and all of that stuff. We just go to the general practitioner and then they refer us to surgeries or whatever it is, but there's so many alternate therapies. And today, we're going to be talking about upper cervical chiropractic. Dr. Kaci is literally just down the street from me, so we're going to take a walk and go from there. Follow along with me. Alright, so Dr. Kaci is literally just down the street from me, and basically she's an upper cervical chiropractor. If you don't know what that is, that's literally what we're going to be talking about today. And I didn't even know this was a thing until I met her just a few years ago when I opened up my studio. Now, if you think about general chiropractic, they adjust your spine as a whole unit. Upper cervical chiropractors only look at the neck. Now the whole concept behind upper cervical chiropractic is that if you have a misalignment within C1, C2, that's where the skull connects into the first vertebra, and if that is jammed up, then it's basically blocking all the other neural pathways to be able to run freely throughout the body. Man, it's slightly overexposed right now. Excuse the white face, it is literally midday right now. And what's very fascinating is that C1, C2 is the only joint in the entire body that cannot self-correct. So if that's jammed up and no one's ever looked at it, maybe there's just a whole bunch of issues that can be going on. And Dr. Kaci's gonna talk about that. Her office is literally just down over there. We'll get to that very soon. Since I was a teenager, I actually never had good night's sleep my entire life. I could never find the right comfortable position for my neck. And I'd always wake up with like chronic neck pain and tension and all of that type of stuff. And I literally have over $1,000 worth of pillows at home. But when I saw Dr. Kaci, literally the first adjustment like freed up my neck and I was actually able to sleep like super comfortably. And that's where I'm going back to see her again today, just so that she can do a quick little checkup and we'll walk you through that entire process and introduce her as well and have her explain the philosophies behind everything. All right, here we are, 5665 Oberlin Drive. All right, we are here. And she's not here yet. We'll wait a little bit. I didn't realize how early I was. I'm always a little bit early. I hate being late. Okay, she's finally here. All right. Kaci!
Come on in.
What's up? Oh, who's this?
Little eyes.
This is a little Isley. Oh, she's got a funny little face. Look at her. That's awesome. So, this is Dr. Kaci. Uh-oh. What's going on?
Oh,
is she alright? Oh. Oh. Oh, there we go. That's a smile. That's awesome. She wants TV?
She never watches TV, so this is like, what is that?
So The Office. I ended up watching the whole series after we met,
Oh,
actually, because it was here.
Funny.
It was so funny. So, yeah, let me know what got you into upper cervical. Why the neck only?
Yeah, so it starts off with why chiropractic initially. My sister is 14 years younger than me, and so when she was 2 years old, I was 16. She woke up one morning unable to walk, and she was crying, and she was in pain.
What?
And it was a week of it, and my mom was obviously at her wit's end, and they just put her on antibiotics, and nothing really was working. And my mom's best friend said, you should try my chiropractor. And we'd never heard of chiropractic. We'd actually never been to one ourselves, but never for children either.
Yeah, for sure.
And my mom was desperate, so she's like, I will do anything. Yes, okay. And I was in the room, and I saw the woman do the full initial exam on my sister and then adjust her, and my sister got up and walked.
What?
After not walking for a week.
Yeah.
Which was incredible. And I was obviously 16, very impressionable, and I thought, what is that?
Yeah.
I want to learn that. So I got into chiropractic for that reason specifically, and I loved the idea that chiropractic had of your body is incredible and is able to heal itself innately given the chance.
Yeah.
But I did not like the message, and it didn't seem congruent of your body's incredible and it can heal given the chance, but you have to see me the rest of your life for that to happen. I didn't really like that. That didn't seem like a cohesive message.
Yes.
So I was searching through techniques within the profession, and I came across upper cervical, which is very different and it's neurologically based. And the focus is getting the body to the point where it's holding the adjustment so that the patient doesn't have to keep coming back in.
Yeah.
Unless some kind of trauma happens again. Trauma being physical, mental, emotional.
That's really cool. So your goal is to not have to see patients
Correct.
over time. Yeah.
Correct.
That's awesome. But there will always be new people who need our service. So it's like, why do we need to
Exactly.
fight to keep the current people that we have, especially if we did a good job and they're able to go? Like, I love that.
But it's especially rewarding because majority of the people that come to see me, they've tried so many other things and nothing's worked. And they've been told they'll just have to live with it for the rest of their lives.
And what cases are those usually?
A lot of like chronic pain, fibromyalgia, migraines, and headaches. A lot of migraines. I have so many people who've been trying to manage their migraines for 20 plus years. But when it's something that is life altering and you have to change your life around it, or if you have to stop doing things, or you're missing out on events with family, or you're missing out on times and bonding, that's something that I think is so detrimental and doesn't need to be the case.
Yeah.
And
absolutely.
I love helping people and giving them a slice of their life back.
Yeah. Okay, so basically after your initial assessment, you do that scan thing first, right?
Correct. So every single visit, we're scanning before and after the adjustment because this is what tells us if your body needs the adjustment.
Yeah.
If you're ready for it. And then the x-rays are what told us where it needed the adjustment.
Gotcha.
So every visit you start with this, and if your body does need the adjustment, we adjust. You rest for 20, and then we scan again afterwards as well.
And so this was my neck. See that thing over there? That should be curved this way.
Correct, yeah. So you can see the back of the vertebrae bodies, and you should see a nice C curve where they all are stacked on top of each other and you have a nice curve to it.
That is what a normal neck is supposed to look like. See that nice little perfect even curve over there with nice little spaces between each vertebra? That's kind of how it should look like. Kaci, like how many people do you actually see that has like a really nice straight, like a perfectly formed neck?
Percentage-wise, I'd say maybe 10%.
10%?
Pretty small.
That sucks. Yeah. So pretty much every time I come to see her, she just does that little neck nerve scan thing, which she's going to do right now. That will tell her if I need an adjustment or not. So let's see if I need it. This little computer tells her what is going on.
So this would mean that I would rest you for about 5 to make sure that your body actually needs adjustment, because based off of this, it looks like it's slightly adaptive.
Yeah. Okay. And adaptive means it's kind of holding still?
Correct.
Yeah.
Correct.
And that's essentially what they want to see. They want to see more adaptive patterns, right?
Exactly.
So that if you're adapting for longer and longer, you don't need an adjustment every time you're in the adaptive phase. That is awesome. So I got vertigo.
Yeah, August 26th.
August 26th. And that's when she adjusted me. And now it's September what?
29th.
29th. So over a month. And I'm still holding, which is not bad. That's kind of what you want. All right. So I'm still adaptive, which means that you won't be able to see me get an adjustment today. But if I do need an adjustment, this stool over here, my head and my chest goes there. I kneel down over there. It's actually very awkward. Like your butt's just like popping up. I guess I'm going to do a quick little demo. It looks like this. So for me,
Body left.
body left. So my head has to go this way.
Correct.
And I'm just chilling here.
There we go. So if he were getting adjustment, it would be a contact on the point that his body actually needs it. And you breathe in and breathe all the way out. Just like that.
Yep. And it's literally just a quick little boop, and that's it. Sometimes it feels more of an adjustment. Other times it feels like nothing really happens. You're just like, oh, there's a little bit of pressure. And then after that, basically we need the body to be able to settle a little bit. And that's where we go into the hangout room with awesome chairs to try and kind of just chill out. Ooh, and we get these cool little anti-gravity chairs.
Zero gravity chair?
Sorry?
Zero gravity chair?
Zero gravity chair.
Feels like anti-gravity.
Zero gravity chair. So, kind of just hang out here. And then she always tilts it for me, which is like, oh. Yep, and you chill out here for like, what, 15, 20 minutes, depending on the person and stuff like that?
Usually 20.
Yeah, awesome. And then basically that just lets all the nerves settle, let your body align with the adjustment. Also gives you a little bit of time to rest, because usually we don't give ourselves that. I had a very hard time relaxing in the beginning.
Yep.
I was always making Instagram posts and all of that stuff, but recently I've actually been able to check out. She hated it.
Not allowing yourself that time to actually adapt to the adjustment and let your body rest. You're still doing a lot of sensory integration when you're looking on your phone.
Yeah, so everyone responds differently. Like, what would you say the average amount of time it needs for people to start holding adjustments for more than 3 days, 4 days, and stuff like that?
More than 3 to 4 days, usually that's within the first 2 to 3 weeks.
First 2 to 3 weeks?
Yeah, usually by the end of 3 weeks to the beginning of the 4th week, I'm getting my patients at that to once a week.
So the whole idea is that they do check-ins. If you don't need adjustment, you don't get adjusted. And then the longer you're holding the adjustment for, the less you need to come in. And that's the whole idea, is that they actually don't want to see you, but they'll see you a lot in the beginning. Is that right?
Correct, yeah. Initially, when your body's not used to being in the biomechanical position, it's focusing on correcting right here. So initially I'm seeing people about twice a week for the first 2 to 3 weeks, usually around 3, and then we can drop it down to once a week, once every 10 days, once every 2 weeks, and we get the body to the point where it's holding longer. And when it's been about 7 to 10 days between adjustments, that's when people see the neurological changes going on really well.
Okay. And the longer it holds, is that pretty much always associated with less symptoms that they have from the stuff that they came in to see you for?
Yes, because symptoms are basically just a sign of dysfunction. It's your body trying to show you, hey, there's something going on, there's something wrong here. And when we figure out that dysfunction, we correct it with this adjustment right there. And when your body starts being able to hold that adjustment for, like I said, a week to 10 days, that's when symptom-wise they're starting to get changes, because now neurologically the body can focus on healing itself.
Basically, after that, she'll retest the scan again and then see if your body shifts into a more adaptive phase. So that's essentially what we're looking for, is we don't want to be in pattern. So in pattern just means that if your body is compensating, you're always in that compensating pattern. So when they do an adjustment, your body is correcting that compensation, so it almost goes in the opposite direction. So that's what I love about that, is like that's patterning the nervous system instead of the muscle. So I like to pattern the muscles to say, hey, if you're always using your right glute to do everything, maybe use the left a little bit. Whereas for them, they're looking at the temperature of the nerves and stuff like that, right? Is that what's
well, it's technically infrared thermography. Yeah,
infrared, that's it. Okay.
So yeah, it's measuring the arterial blood flow, and those are controlled by the autonomic system, which is your nervous system.
Yeah.
So
sweet. Yeah. So they want your nervous system to not be in pattern, because if it's always doing the same thing, that's usually what's causing the issue. So as long as you're not doing that exact same thing, your body will find another way to reroute and get a little bit better. So I guess what would you say your message is to the world?
I'd say my message is there is hope. A lot of people, like I said, by the time they come to see me, they've tried everything and they're almost at the end of it and they think there's nothing else. Or they finally get here and they think, I've tried everything else, what is this going to do? But as long as they still have a little bit of that seed of hope, and they also have the understanding, and I think most people do, that we have the innate ability to heal given the right options, then this is something that would be massively beneficial if there is a neurological component, which majority of time when there's a lot of symptoms it is.
Yeah.
Because what can happen is, I describe the nervous system, just ending with this, like a cup. It's like a cup, and then when you have a fully functioning 100% working nervous system, it's like you have a giant big gulp cup. And any amount of stress that you put into the body, any amount of water you're pouring into that cup, it can handle it up until the point it fills up and overflows. And when it overflows, that's when you're experiencing those symptoms. So when your nervous system's not working at 100% and it's decreased function, it's like you have a little shot glass. So a little bit of stress causes those symptoms to overflow, which is what happens so frequently in people who experience chronic pains. Migraines, fibromyalgia, these things, especially with migraines, people can easily relate. a trigger, like sunlight or loud noise or something, some kind of external stressor.
Yep.
Massive overflow, big symptom change immediately. So this allows the nervous system to change from a little small shot glass to a giant big gulp. So you can put a lot of stress into it before you experience any symptoms.
Yep. I'm all game for that. Like whatever tools that you have, whether it's upper cervical, whether it's general chiropractic, whether it's massage, movement, exercise, all of that is a tool to give you access to utilize your body in a more efficient way. And if whatever tools that you have aren't working, find other tools that work. And upper cervical is just one of those so undervalued or just underpromoted professions.
Mostly a lack of awareness.
Yeah, lack of awareness. That's just, I didn't know that it even existed. I just thought chiropractic was chiropractic. I never knew that there was just one profession. Actually, just out of upper cervical, there's 5 branches of different treatments, right?
Different styles.
Yeah, different styles of just looking at the neck, which is incredible, and that is something that I just wanted to show to you guys, that I've been under her care for the last 2 years now, and the results have been awesome. So I just wanted to show that stuff like this actually exists. So there is hope, and that's the message. Andy Schiffer Moon Reborn, Dr. Kaci Madden from the specific San Diego, right?
Correct.
I didn't realize how long that was. It was about 16 minutes. So if you watched all the way till now, thank you so much for watching. If you're not in San Diego, obviously there's so many upper cervical chiropractors. Look up different upper cervical techniques. There's Nuka, there's Blair, there's knee chest, and other techniques as well. If you're interested in that, try to look it up and find a practitioner around your area, especially if you're dealing with migraines, fibromyalgia, and those chronic neurological conditions that people say there's no cure to. Definitely take a look at that if that is something that resonates with you. I'll put more information about Dr. Kaci and upper cervical chiropractic in the description below. Hopefully you enjoy following me along with this journey. The next episode is going to be pretty freaking cool. So please like and subscribe if you haven't already, so you can get notified every time I post a new video. That will help a lot in continuing to expand this channel and exposing awareness to movement and healthcare in general. My name is Andy Schiffer from Movement Reborn. Have an awesome day. Peace!